Hi, everyone. It's Monday, March the 24th, 2025. My name is Kevin Brewer, and tomorrow morning at Vanderbilt University Medical Center in Nashville, I will be undergoing double orthognathic jaw surgery. A lot of people have been vlogging this experience on YouTube, but almost all of them are many years younger than I am. I'm nearly 60. And I am undergoing this rather grueling procedure that has a very long recovery time and a very difficult recovery experience tomorrow morning. And some people have asked why I'm doing this at my age and so forth. So I thought that I could vlog my experience as easily as anyone else could. And maybe someone would be interested, and maybe it would be helpful to someone who is going through what I have gone through on the approach to this. A little background here. I will be 60 next week, and I am a history teacher in the Benton County, Tennessee public school system, where I have been teaching for 30 years. Starting today, I'm taking medical leave for the rest of the 24-25 school year and won't be going back until August. And if all goes as planned, when I go back in August, the structure of my jaws and really even the lower part of my face will be quite different. The background on the procedure itself that I'm having done is that when I was about 11 years old, a local dentist told my parents that in order to make some room in my upper jaw and perhaps save them some money on orthodonture down the road and to reduce the, crowding in my upper jaw, he was going to remove a couple of teeth, which was fine. They didn't second guess him. Unfortunately, instead of removing a premolar or something on either side, he actually removed my upper canines, the corner teeth of my mouth, the pointy teeth. And this has had really disastrous results for my overall dental health and dental presentation. I still have my lower canines, and I lack the upper canines, and that really changed the structure of my upper jaw. When by the time I was in high school, I had developed a slight underbite, which is to say that my mandible, my lower jaw, protruded slightly, very slightly at that time, slightly farther ahead than my upper jaw, instead of the other way around. The upper jaw should slightly overlap the teeth of the lower jaw. I didn't think much about it at the time, but as I grew older and became, more aware of how I looked and so forth, I began to notice that the condition of my upper teeth was not good. For one thing, instead of having a nice rounded upper arch, I had sort of a V shape where my front upper incisors were fine, but the next incisors from those sort of tapered back at a more pronounced angle than on most people. And then from there, you could hardly see any teeth at all because they disappeared into this V formation that formed the teeth of my upper jaw. As I matured and ended up in college at the University of Tennessee, I still don't think that it impeded my lifestyle very much and didn't have a tremendous impact on the way I looked. But I was aware that the underbite was becoming more pronounced. I had a friend who was in my fraternity, and he and I had sort of a running joke in which he would tease me for being unable to bite thin foods. An ongoing problem was that I would bite into a sandwich or a hamburger or something, and bite through all of it except for a thin slice of tomato, and especially except for a leaf of lettuce, which I could not bite under any circumstances. And then because of that, I would end up with a mess. And as I pulled the burger away, pieces of lettuce and tomato and mustard and ketchup and what have you would fall onto my shirt. It was a nuisance, but it was something I didn't think about all the time, and it didn't impede me socially. As I grew older and went into my career, especially as a teacher, talking all of the time and interacting with people constantly, I did become more and more aware that even then it was becoming worse. Until finally the offset between my lower teeth and my upper teeth was quite significant, to the point that there was really no contact at all in the front of my mouth between my upper and lower teeth, and it had really become impossible to bite most anything. I could still chew okay. I did not have trouble eating, but biting had become a real problem. Beginning about 10 years ago, I began biting accidentally, usually while eating, the tissues of the inner side of my cheeks. And I would occasionally sort of bite a plug out of my cheek, which was obviously very unpleasant. And it stayed sore all the time, and I never knew when that was going to happen again. I did it one day at dinner here at home, and my wife Leslie said, and I can still remember it so clearly, she said, "There may be orthodonture in your future." That seemed like almost like something of a joke. At my age, I was in my mid to even late 50s. I had raised 3 children, more or less to adulthood. All 3 of them had braces. I had spent a fortune on braces. Dental insurance partially covers braces for children. Dental insurance, at least mine, does not cover any part of braces for an adult. But as the problem became more pronounced, a couple of years ago, or about a year and a half ago, in the fall of 2023, I decided to make an appointment with my kid's orthodontist, Dr. John Colgan, who operates out of Paducah, Kentucky, which is about an hour and 15 or 20-minute drive from here. But he works a day or two a week in Murray, Kentucky, which is only about a 30 or 35-minute drive from our home. And I went to see Dr. Colgan, who is a wonderful man and a great professional and a great orthodontist. And he did a full evaluation, and he came back and said, "I can straighten out your teeth. I can solve some of this problem. I cannot fix it. This problem, if it's going to be fixed, it's going to require orthodonture on the front end, followed by, and probably about a year of orthodonture on the front end, followed by very significant surgery, then probably followed then by a few more months of orthodonture." And he indicated that he wanted me to go to Vanderbilt and see Dr. McKenna. And he named that specific surgeon and came pretty close to saying that in my case, he would not participate in the treatment on the orthodontic side unless I agreed to have the work done at Vanderbilt by this very superior orthodontic surgeon or maxillofacial surgeon. So I secured an appointment with Dr. McKenna at Vanderbilt on Dr. Colgan's recommendation, and there was some behind the scenes, I think, collaboration between Dr. Colgan and Dr. McKenna involving my case as well. And I went to see Dr. McKenna. I had a very extensive, very sort of high-tech evaluation there. And he came back and said that, yes, I had all of these problems and that they required, if they were going to be fixed at all, I was going to have about a year of orthodonture, followed by orthognathic surgery, possibly double orthognathic surgery. So let me take a time out there to talk about what's actually going on with my teeth and what these surgeries involve. Now, my teeth today are not in the same condition that they were in when this started because I have been in braces for 11 months. My upper arch, which was once sort of V-shaped, and most of my teeth disappeared off to the sides, and you probably wouldn't be seeing them. Today I have a much more rounded presentation there. My lower teeth, and you can see the canines on the lower side, which were not taken out by my dentist. But you can see here, and this is quite dramatic, this is my bite. Now notice, as I do that, my teeth are together. My molars are all in contact. That is my bite, completely open in the front, open by as much as 1/4 of an inch, maybe more. You will also notice that on this side it is more open, and that is because my lower jaw is not only significantly in front of my upper jaw, it is also offset. Furthermore, the underbite has been made worse by the orthodonture. Now, I was told that that would happen. That's part of the process because I had a palate expander for 5 months from April to September 2024. This sort of medieval torture device in the roof of my mouth, and I had to take a little wrench and turn it one turn every 3 days and pry those bones apart and slowly spread my palate apart and round out my teeth. I did that. That thing luckily was removed in September of 2024 because that was a real chore. In fact, that's the worst thing that I've endured yet was just dealing with the day-to-day problems of having the palate expander in terms of eating and speaking and doing my job and so forth. But as those upper teeth were widened apart, as my palate was expanded, it pulled the fronts of my upper teeth back, making the underbite much worse than it already was, and it was already significant. So there's no going back now because I have worsened my bite in preparation for the surgery. Now, Dr. McKenna, the surgeon, surprised me by telling me, and I had always assumed that the problem was that my lower jaw jutted out too far. That seems easy enough to understand. And you don't usually see yourself in profile, but you can see my profile. I'll show you. I'm going to bite my teeth together and give you a profile on either side. Easy enough. My lower jaw juts out far too much. Turns out, no. Dr. McKenna said that I have he said you have a strong chin. It's where it should be. The problem is not that your lower jaw sticks out too much. It's that your upper jaw doesn't stick out enough. Now, I think everybody's accustomed to the idea of having a mandible. It's obviously separate from the rest of your skull. and you can move it around. I don't think most people who are not dentists or orthodontists or physicians of some other kind, we don't think of ourselves as having a separate thing, separate from the rest of your skull, that you think of as being an upper jaw. But there is. It is the maxilla. This, of course, is the mandible. This is the maxilla. And in my case, it is back too far. In fact, he said if he could avoid it, he would not move my mandible back at all, because moving the mandible back can, in some cases, lead to or worsen sleep apnea and what have you, that if he could avoid moving it back at all, he would. Now, it turned out he was not going to be able to avoid it, but that most of the surgery would consist of moving the maxilla forward by a whopping 6 millimeters. So with the final workup, when everything was said and done, and 3D, there were scans made of the inside of my mouth, and then that was used to build 3D models of my jaws and my teeth. And he finally concluded that he was going to move my lower jaw back 1 millimeter, which of course is very small, and was going to move my upper jaw, the maxilla, forward 6 millimeters. And this is going to be very significant and traumatic surgery. And I saw Dr. McKenna off and on throughout the late part of 2024 and the early part of this year, 2025. At the same time, I was having other appointments with Dr. Colgan, the orthodontist. One of the last appointments with Dr. Colgan, he put hooks on most of my teeth, upper and lower, which are part of the preparation for the surgery. And this was all being done in cooperation with Dr. McKenna. And finally, Dr. McKenna scheduled my surgery for 9 o'clock a.m. Tuesday, March the 25th, which is tomorrow. So what's going to happen here? In this surgery, which is going to take apparently somewhere between 7 and 8 hours of actual anesthetized time, they're going to cut through both jaws back here somewhere, or cut through both sides of the lower jaw back here somewhere, remove, I guess, a tiny sliver of that bone, and then set this jaw back 1 millimeter. By the way, that is all accomplished through incisions made all the way around at the gum line inside the mouth. There are simulations of this on YouTube. I do not recommend watching them, and I sometimes regret that I have watched them. And it's been frustrating to my wife to see me watching them, because she doesn't think I should be watching them either, and she's probably correct. More incredibly, because I think most people can sort of picture the lower surgery, the upper jaw surgery is something that even in simulation really has to be seen to be believed, and that includes or entails an incision all the way around at the gum line, similar to on the lower end, and then all of this bone will be cut away with a saw or with a sort of a Dremel-like instrument, and the upper jaw will be broken loose from the other structures of my skull. It will be pulled forward 6 millimeters, straightened to fix the offset, the off center, and on both the upper and lower, it will all then be bracketed together with titanium brackets and tiny little screws that will stay there indefinitely. They will become incorporated into the bone and become incorporated into the soft tissues, and will stay there for the remainder of my life, unless they present some sort of a problem or something in the future, in which case they can be relatively easily removed after a year or so of doing their job, which is to hold my jaws back together. As far as getting the bite right and making sure that my teeth are correct, even though the surgery is not until tomorrow and it's in Nashville, in a couple of hours I'm driving to Nashville today for a 3:50 appointment at Dr. McKenna's clinic. And there they're going to make a splint of my jaws, which they will use to position during the surgery, that they will use to position my jaws the way they want them. They will then clamp my teeth with wires on the braces down on this splint to have everything exactly the way they want it. And then they will screw the jaws back into place where they need to be, and then they will unwire my teeth, remove the splint, and then band my teeth together so that the jaw can heal. So what's this going to be like? My understanding is that the actual pain is minimal. Some people who have had this surgery have actually indicated that they were not in much pain at all. But the unpleasantness of it is really rather extreme. Everything, both inside and outside the mouth and throughout the lower 2/3 of the face, even including the eye sockets, everything will be bruised and incredibly swollen. All of the soft tissues are going to be swollen together. My teeth will not be wired shut, which is what I initially thought was going to happen, but they will in fact be banded shut with tight rubber bands, and those will stay on pretty much all of the time. They indicated I would be able to open my teeth just enough to get sort of a baby toothbrush in there, or to help get a straw in. I'm going to, for the first couple of days, and I will be in the hospital for at least one night and possibly two. For the first couple of days, I'm going to be on a clear liquid diet only, consuming nearly nothing. And then after the clear liquid diet, I will be on a liquid diet for weeks, of smoothies and things like that. I will not be able to chew anything. At some point, I will be upgraded to a soft diet, but it will still be no chewing. At that point, I can eat anything that I can swallow without chewing it, including mashed soft vegetables and things of that sort. But I will not be chewing anything for probably 2 months. And that's, obviously that's going to be sort of a trial. And the swelling and the breathing difficulties and all of those things are going to be a trial as well. I will have to sleep sitting up for 2 weeks in a recliner, which I'm set up for that. I will have the surgery tomorrow. Tuesday night I will spend in the hospital. Wednesday morning sometime we will probably be released to come home, at which time my wife Leslie and my 2 younger kids who live in this area, my elder daughter lives away, and they are all going to take care of me, and I will probably require a lot of care for the first 4 or 5 days, maybe for the first week. And I have a recliner set up, and I have a sick room set up, and I have a television in there, and I have some hobby things and things to read and that sort of thing. But I understand the recovery is going to be quite extensive. Many people on YouTube have shared again their experience with this surgery, but not many of them are my age. I don't think I've seen anyone doing it who was my age, and that of course presents special concerns. Why am I doing this? Because it was becoming an ongoing problem. My insurance, although my insurance did nothing to help with the braces is a bill that could be handled. Luckily, my medical insurance is, in fact, paying for the surgery. The surgery, of course, without insurance would not be a doable proposition for ordinary people. I don't know how much the surgery is. I figure it's in the neighborhood with all of the hospital care and everything else. I figure it's in the neighborhood probably of $50,000, maybe more than that if you combine it with the orthodonture and all of the other incidentals. I'm sure that this is going to end up being probably a $60,000, $65,000, $70,000 undertaking. So I'm very grateful to have good insurance through my employer. And they did definitely consider it to be a medical necessity because of the cheek biting and because of the difficulty chewing and also because of the wear and tear that the unnatural position of my teeth was placing on my gums and on my molars, the chewing surfaces of my molars. So, how am I feeling about this? I am, now that it's here, nearly, I have become quite apprehensive. I don't think I can describe myself as scared at this point. I'm not feeling that at all. Mostly, though, I'm feeling excited about the whole thing. I'm doing a big thing. It's a big deal. I've had a lot of time to prep for it. I've had a lot of time to think about it. And now it's here. And there's a certain amount of relief in just knowing that I planned for something and that I've done it. The fact that I've been wearing braces for 11 months and that those 11 months have led to something makes the arrival of that thing easier to take. I have told both my surgeon and my orthodontist, I said, I am all in. I want this done to the extent of your ability to do it. I'm not looking for half measures. I'm not looking to get by. I want it done as well as it can be done. And they have been very receptive to that, and we're happy to hear it. They said that having a good attitude about it was one of the keys to recovery, along with drinking plenty of water, staying hydrated, trying to walk a little bit every day, very carefully, of course, slowly and not very far, but just getting a little bit of walking in every day, which should help with the swelling, because swelling is really one of the primary, if not the primary concern of the whole thing. The swelling is going to be extensive. My plan, if I can pull it off, and if anyone shows any interest, is to try to put something on here once a day, maybe not at the very beginning, but whenever possible, to show you what I look like. I certainly will not be doing these kinds of long form expositions, because I have seen enough of these videos with people younger than I am, obviously unable to talk or to make themselves very well understood. But I may post some images just so you can see, because this time tomorrow, I'm not going to look like this, and I'm not going to look very good at all this time tomorrow. But I'm not going to be downhearted about it. I know that it's part of the process. I have a huge and tremendous support system. My employers at Camden Central High School in the Benton County school system have been so supportive in helping me secure time off and in being just completely behind me all the way. My wife is wonderful, as are my kids, all three of them, about this, and have been very supportive. I have lots of good friends and fraternity brothers and my cousins and people who have offered to help in every conceivable way. I'm going to take it easy for the spring and for maybe the first half of the summer, have an unprecedentedly quiet stay-at-home time and recover from this rather huge assault to my body. And we'll see what happens. I will have to wear the braces for an undetermined number of months after the surgery, and then they will come off. And at that point, I should have a really impressive smile, and I should look considerably different than I look right now. And total recovery time, where all swelling, even the hard to see swelling, is gone, is expected to be something like a year. So it may be March 2026 before I can say that all of this is truly behind me. If this video speaks to you, has been of any use to you whatsoever, if you are anyone who is considering orthognathic surgery, anyone closer to my age who is considering orthognathic surgery and is interested in following me on this adventure, then please comment below on YouTube and let me know what you think. Also, if you have anything to recommend, because this is not the kind of thing that I do on a regular basis either. So thank you for watching. Thank you for listening, and wish me luck.